Okay, changes to Meditech updates September 23rd, 2015. Um, okay, so the first thing that we changed was the primary care physician should auto-populate from the nurse's triage note. So you may see a primary care physician up here. If you need to change it, you can delete it and add it in, but hopefully that will be correct as the nurse should have just taken it. There's no changes in review of systems. Just take note, a little tip here, to use spell checker. If you right click on this word, it will spell check these words for you. So I tend to use that a lot. Under past medical history, we added a couple more past medical history common things. That should be ADHD. We're going to fix that. Bronchiolitis. I think we added non-contributory. RSV, seasonal allergies, reactive airway disease. There may be eczema. So these are all new additions. There's no changes in physical exam or differential diagnosis results. The thing we changed was for CT scans. Under brain, we added no signs of bleed and symmetric, so that there are three things that we could always check on if it's normal. Or it looks like four, including normal, because of coding and billing wants three things to check when we review that. Under procedures, for splinting, we added a couple more options, including long posterior arm splint for elbow fractures. The ASOs that we currently have are ankle stabilizing orthoses. Those are those sort of cheapy ankle sprain splints. Buddy finger wrap, anterior posterior short arm splint. I think we added that. There may be more that we added there. Also for procedural sedation, we added that the nurse, you can easily click that the nurse was present, and vital signs monitored on CRM during the procedure, usually ketamine. Again, this is for coding and billing. It seems that they want these two things, so that was added. Just take note that for procedural sedation, if you're using something like ketamine, I think you only get credit if the procedure was, I think it's 30 minutes. I'll have to double check on that, of you taking care of the patient during that time, and take note of these easily also checkable things. The other thing we added was, oh, I'm sorry, back to results. Down here, there's now a rhythm strip cardiorespiratory monitor. If your patient's on a CRM, you have the option of clicking normal sinus rhythm and appropriate heart rate, and then again hitting time now if it's that time, interpreted by me. And this can be helpful. One of the reasons it can be helpful again is for coding and billing, but also just that the fact that you looked at the monitor, it was in normal sinus rhythm, and if the heart rate was appropriate or not. So just take note of that. I think that's helpful. EKG. We also added interpreted by me. Before we had to look up our name, which took a little bit of time and I guess was kind of annoying, but now you can just hit interpreted by me. Okay, so I showed you these procedures. Course. Okay, this is kind of significant here. I'm going to close these. So under progress note, we added some more options. We added patient without complaint. Let's say that this is a progress note an hour into their stay. You can hit now. And just some more options. Tolerating PO fluids, patient re-examined, no vomiting, well appearing, no distress, patient without complications, abdomen soft, non-tender, normal bowel sounds, acting appropriately. And the idea here was to make this easier when re-examining patients with perhaps vomiting or neurologic complaints or whatever. PMD contacted and care discussed. Also, you have the option of here's asthma. So we see a lot of asthma patients. When they first come in, you can say albuterol, atrovent, and steroids given. And then subsequent notes, you can write an albuterol neb was given. You get a second pop-up box. Maybe one neb was given, inhaler, or you can do inhaler spacer. And then this is the assessment. Welapiri, no distress, no improvement or improvement. Obviously, you wouldn't click on this many. Just some more options. It doesn't just take away from anything that you were doing before because you don't have to click on any of these. You can still free text on comments here. So hopefully that will be helpful. And then the last thing so far is the ICD changes. Okay, essentially it boils down to this. Some diagnoses we're going to be asked to enter in additional qualifiers. Sometimes it's a little ridiculous. For example, if we diagnose otitis media, a pop-up box is going to pop up next to it that says qualifiers. Note that it's yellow with a little exclamation point. It wants us to choose additional options. Now, this isn't me. This isn't St. Agnes. This is the whole nation. This is the whole government that wants this. Again, it's a little crazy, but if we can, we should choose otitis media type. Suppurative or other non-suppurative, right, or bilateral, acute, not specified. I don't think you have to choose all these when doing this, but do your best, and then it'll pop up until once this qualified code. So acute, suppurative, otitis media, without spontaneous rupture of eardrum, bilateral. Okay, and then once I hit save, it'll be green, and it'll be okay with that. Here's asthma, so mild intermittent, mild persistent, moderate persistent, severe persistent. If you're not sure, just go ahead and put unspecified severity. This is, I think, for more primary care stuff, but if you know, you can pick one. Sometimes it's obvious. And then with status asthmaticus or acute exacerbation. Take note that not all diagnoses need a qualifier, but some do. We went ahead and simplified it this way. I think it's pretty easy. If you don't do this, if it remains yellow, you can proceed. It's not going to make you do it. But perhaps in the future, St. Agnes might want us to enter that in later. So if you can, just, we'll probably get in the habit of doing this pretty quickly. But those are the changes. That's ICD-10 training for you as well. Also, we added in a couple more conditions on disposition, and we added that you can choose one or more at a time. So before it was just these, I think, and sometimes they're good and they improved, or they're good and they unchanged, or they were unchanged. So you can hit a condition on discharge. Let's say an patient with asthma came in and you discharged them in good disposition and they improved. You can hit that too. That's it.